Hi, my name is Emelina. Today we will be discussing um, how we can improve oral health service utilization among children in low-income communities. So the intervention that we are trying to utilize is the mobile dental unit program, providing oral health services to children in low-income communities. The problem is that there is a variability in parent consent and follow-up appointment rates when scaling up a mobile dental unit intervention to more diverse school settings. So the evaluation outcomes, so the initial pilot phase was effective. Um, it showed great improvement to parent utilization to the dental services. But when we scaled up the implementation, it revealed variability in parent consent and follow-up appointment rates. So we need to identify factors influencing the effectiveness and adapt to the intervention. So implementation science is the study of strategies for promoting the application of research results and evidence-based treatments in actual public health and healthcare settings. So the point in the implementation cycle that we are utilizing for this um, program is the adaptation phase, understanding factors influencing variabilities in implementation outcomes. So, in this mobile dental unit intervention, adaptation involves identifying the factors that influence the variability in parent consent and follow-up appointment rates and making adjustments to the intervention to improve its effectiveness. So, the research question is what are the key factors that influence the effectiveness of the mobile device unit intervention in increasing oral health services utilization among children in low income communities? And how could the intervention be tailored to meet the needs of diverse school settings? So, we will be using the theoretical framework, Consolidated Framework for Implementation Research, CFIR, which identifies five domains that influences the implementation. So one, the intervention characteristics, understanding the characteristics of the mobile dental unit intervention, its complexity, adaptability, and perceived benefits. Two, outer setting, examining the external factors that may be influencing the intervention's effectiveness. Um, which could be something socioeconomic if they don't have enough financial resources, the availability of dental services in the area, and any cultural barriers that may stop them from receiving oral health care. Three, inner setting, understanding the internal factors that may be influencing the intervention's effectiveness. So the school policy, staff buy-in, and additional resources. Four, characteristics of individuals, examining the characteristics of the individuals involved in the intervention, the parents, school staff, the dental hygienist um, from the program. And five, process, understanding the process involved in implementing the intervention, planning, execution, um, and evaluation. So when we address this research question, we can identify necessary adaptations to improve the effectiveness of the mobile dental unit intervention and improve oral health outcomes for children in low income communities long term. So we will be using a mixed methods approach. Um, the quantitative data, which would be surveys and administrative records to analyze association between school characteristics and oral health service utilization, and qualitative data, interviews with parents, dental hygienists, and school staff to explore barriers to oral health care. So using this approach, it combines the quantitative and qualitative data collection and analysis methods to provide a comprehensive understanding of the factors that can influence the intervention's effectiveness. So with the quantitative method for surveys, I will conduct surveys among parents and caregivers of children who have received or are scheduled to receive dental care from the mobile unit. The survey will collect data on demographic characteristics, socioeconomic status, and experiences with the mobile unit. Administrative records, I will analyze the administrative records from the mobile unit that includes data on appointment scheduling, attendance, and follow-up care. So for the qualitative method, um, I will conduct in-depth interviews with parents, caregivers, school staff, dental hygienists to gather more nuanced insights into the barriers and facilitators of the intervention's effectiveness. And I will also conduct focus groups with parents and caregivers to discuss their experiences and perceptions of the mobile unit and identify potential areas for improvement. Community stakeholders. So the community stakeholders for this program would be the parents and caregivers, school administrators, staff, dental hygienists, and healthcare professionals, community leaders, and organizations. This study will engage with these various community stakeholders. The parents will provide input on their experiences and perceptions of the mobile unit. The school staff will offer insights into the school policies and resources that could influence the intervention's effectiveness. The dental hygienists will share their experiences and perspectives so far on the delivery of dental care services. And community leaders could provide input on the broader community context. So the community needs and potential barriers to accessing dental care. And the adaptation is taking the intervention to meet the needs of diverse school settings, addressing drivers of health disparities. So, limitation and future directions. So, limitations include potential biases um, in sampling, data quality, limited generaliz generalizability, and time frame. So for sampling biases, participants may not be representative of the larger population of low-income communities. Data quality, the accuracy and completeness of administrative records and survey data may be limited, which could impact the validity of the findings. And generalizability, the findings may not be generalizable as interventions effectiveness may be influenced by local contextual factors. And the time may be limited, which could also impact the ability to capture long-term outcomes and the sustainability for the intervention. So the application, um, informing policy practice, improving intervention effectiveness, guiding resource allocation, and promoting sustainability. So um, it can inform policy and practice decisions related to dental care services, interventions, can identify areas for improvement, which can inform adaptations to increase the effectiveness. It can ensure resources allocation are targeted towards most effective strategies. So the future directions would be long-term follow-up, comparative studies, and scalability. And that is it. Thank you for your time.